Welcome, everyone. Thank you for joining us for this lovely session here. We will be talking about changes in personality after a brain tumor. So, as we go through this presentation, we'll be talking about some strategies, what we can do, whether you are the patient with the brain tumor, or if you are the caregiver, family member, what have you. Because as we know, brain tumors are pretty terrifying. As we relate to the brain generally. It's how we see the world, hear the world, taste, smell. Really, all of our senses are tied very much to this organ. And so, anytime something happens, whether that's a lesion, whether that's a traumatic brain injury, whatever that may be, it can cause those shifts in our sense of self, and then how that impacts our family structures, our families, really just our way of communicating with the world. So we definitely want to approach this with the level of care and severity that it deserves. So we'll go ahead and jump in. There's going to be a little bit of neuroanatomy class, but we'll kind of breeze through that because I really want to make sure you folks know what options you have, what you can do. In moments that maybe feel a bit more overwhelming than you've ever experienced. And so let's go ahead and jump in. So, in thinking about when the brain tumor is diagnosed, one of the first things we think about and consider is the emotional shift, right? Now, this is going to happen for both the family and the patient, but as it happens with any cancer diagnosis, you're probably feeling isolated, probably quite afraid. And so this can obviously create feelings of anxiety as uncertainty starts to play its course, depression, maybe even a bit of grief as you start to mourn the life that you were living, or even mourning the expectations you had. We call that anticipatory grief. But we always want to sort of think about, okay, how am I going to move forward? Where am I in the present? As we move through this presentation, a lot of my practice, and I'm a counselor here at the center, is based in mindfulness, which is all about awareness, being present, and really just trying to understand where we are at this time, right? And so as we start to undergo these emotional shifts, we need to really sort of focus on the fact that we're not alone. And if we are alone, it's really important to try and reach out, find some community, whether that means, okay, I'm going to join a support group or I'm going to start doing some activities that are going to help me along the way. But we want to just sort of be assured that isolation is not too much of an issue, right? And now, one of the bigger things that we're going to discuss here that many brain tumor patients experience is irritability and mood swings. Now, if you're the caregiver or the patient, you may be familiar with this, and these can come in any shape or form, right? This can mean feeling sad out of nowhere. This can mean depression. This can mean anger. This can mean irritation. Whatever way it manifests is partly to do with the way your brain is set up, but it also may have to do where the tumor itself is within your body, right? And so we'll just keep moving here. And so, in thinking about the outcomes for what can happen after diagnosis and how this tumor may affect you, so obviously we know that for some there may be a quicker decline as far as memory, cognition, so on. For some folks, they may not actually experience any changes, and so these are a couple things that can influence that. So education. This one is an interesting one just because, as we know, the brain is kind of a vast web and network, right? And so the more memories we have, they sort of work like clusters that are able to sort of be linked together, right? And so the more I know, the more attachments there can be, and thus a strengthening of my knowledge. And well-being, really, ultimately. We also have to consider the medications, some seizure medications, steroids, treatments. All of these things are going to ultimately affect your body. There may be environmental influences. So where you live, do you live in a closed space? Do you live in a open space out in nature? Are you in the city and it's loud and frustrating and you're not able to ever actually have peace, right? This can also affect your mood, as we all know, if you've lived in the city or have ever been sort of cooped up with some neighbors or friends that you didn't want to live with, right? Next, tumor location. We'll go into that a little bit more broadly. As we know, different regions of the brain affect different aspects of personality, wellness, and being. Fatigue, of course, one of the major things we definitely know once you start treatment, you're going to experience some degree of exhaustion, fatigue as your body is trying to sort of heal itself, right? And if you've ever been around a baby or a child who was unable to get their nap, you know that the crying is not far off, right? And so when we think about fatigue and how it affects us as adults as well, we know that not getting a good night's sleep, especially if that's due to treatment or just discomfort or whatever that may be, we're not encoding our memories very well. We're not able to engage in the ways we want to. It just sort of spans out to so many different areas of our life. And then, of course, age. Obviously, younger is better, but the more active you are is obviously going to be helpful as well, just based on circulation and your ability to sort of coexist with others. And then comorbid psychiatric illness. So if you have a personality disorder, if you have depression, if you have anxiety, right? These are all things that are going to ultimately affect the way you engage with the world and thus how this tumor may affect you. It can really accentuate that or aggravate it. And so let's talk a little bit about cognition, which is a fun word for thought processes, right? And so when we think about cognition, there are four categories generally. There's attention and concentration, there's memory, of course, executive function. So this is really how we're able to sort of operate in the world, right? I'm able to decide, okay, what sandwich do I want when I go to a restaurant, and can I do so with expediency, right? But if my executive functions are declining, I may have a lot more trouble, and it might not just be because I don't know what to order. It might be because I'm having trouble even reading this document, right? All of a sudden, the room maybe feels a bit darker, or maybe I feel a lot more pressure, or maybe, any number of things can be impacting our means of controlling our actions, right? And so there's a bit more slowness, or maybe even a delayed response as far as our ability to move ahead. And then lastly, processing speed, right? Which is sort of tied into that. Now, if I'm reading, I'm listening, I'm learning, I may not be able to pick up on things as quickly, right? And so I really need things to be either slower or at a pace that I can understand so that it can sort of stick, right? And so when all of these things are affected, and it might not be all of them. Generally, we're going to experience some memory loss, especially if it's chemo. And you may know about the phenomenon called chemo brain, which can lead to a sort of fogginess, poor memory retention, fatigue, all of these sort of fun things. But they all fall under this umbrella of cognitive function. Okay. And so, how does treatment affect cognition? We'll just go through this briefly. So, we know that with chemotherapy, this can disrupt how the brain is able to care for itself and its nerves, right? And so, what we know with the axons, the nerve cells, they are all sort of webbed together. And so, the chemotherapy can sort of slow that process down, right? Whether that's the sort of electric patterns that are going on or just even what you know as your sort of normal processing rate, right? Sort of coming back to that chemo fog. Radiation, which can harm the blood vessels. If you have had radiation, you already know some of the sort of pain that that comes with. And as we know, it can lead to a lot of bruising, scar tissue, and so on, right? Which can interrupt our brain's body to communicate, right? And as we know, the cells are transferring all sorts of information, hormones as well. And once those pathways are slowed, we're not able to either think or function in the same way. And this can take years to repair, right? Whether you have brain tumors or not. And then lastly, thinking about steroids or anti-seizure drugs, these can also, just sort of as listed side effects, cause to a worsening of symptoms around memory and cognition. Okay. And so, sorry, this is a little wonky with the getting the numbers on the page here. I'm no longer in middle school, so I don't know how to do all the fun stars and transitions. So, in thinking about cognitive and behavioral changes, which I think we're all here for, right? We need to think about several factors that can lead to these changes as well, right? So, in thinking about the brain tumor region, which I'll get into more in the next two slides, the brain is made up of a number of different zones, right? And each of these zones sort of impact a different part of our functioning, whether that's how we learn, how we speak, if we understand language, mathematics, like really all of these different means of perception and engagement, okay? Next, we want to think about increased intracranial pressure. So this sort of means if there is a tumor in the brain, right, it is taking up space. And we, of course, have a limited amount of space within our cranium or our skull, right? And so once this pressure begins, this may lead to irritability, cognitive fatigue, which I'll really get into a bit more later. But we might notice that we're feeling a lot less patient in moments, right? And our threshold for frustration starts to decline as a result, okay? And as I mentioned before, with decreased neuronal activity, that just meaning our brain chemistry isn't functioning quite as well, right? And so the things that really make us us have shifted, right? Which can lead to fatigue and motivation issues, right? We're no longer waking up in the same way. And we all know when we're tired, we don't really want to do all that much. We need rest. And as we know, our physicians always will instruct us to prioritize rest, right? During treatment. Language and expression, which we can get into a little bit more later. So this can be like slurring, this can be your inability to read, this could be really any means of you learning and engaging with words and language, right? Then memory and of course emotional dysregulation, right? So this sort of shifts in how you behave, how you experience, how you witness sadness, any of these sort of things, right? Which you may have witnessed in your partner or the patient has witnessed themselves. So if you're noticing these changes, don't be all too surprised. Just know that this is part of the process, right? It may not be permanent. And so, in thinking about how we understand the brain, I want to sort of look at these four primary lobes. Okay, we have the frontal, the parietal, and the temporal, and the occipital. Okay, now, I'm not going to get too much into this because this isn't really why we're here. You can certainly look up this information on your own, but what we know is that based on where the tumor is, that's going to ultimately affect how the individual functions differently, right? And so, in thinking about, okay, if it's in the frontal lobe, which is really responsible for higher level executive functioning. We might see disinhibition, so a loss of that filter. It might have a little bit more foul language at the brunch, or they may say things to you that are just downright hurtful, right? It's going to be quite blunt or rude, or the opposite, right? Maybe they're overthinking now, and every aspect of thought is slowed as a result. They also may experience apathy, right? No longer caring, no longer having interest in the things that once brought them pleasure. It's very challenging, I think, to determine is this depression or is this the tumor, right? This is why it's so important to have these scans so we have really all the information we need. And then there's, of course, voluntary movements, how we're able to sort of move. We may, depending on what side the tumor is on, if it's on the right side, we know that that affects the left side of the body, right? And so that part of the body might not be moving quite as well anymore, right? And we've seen this in folks with strokes as well. Moving down to the parietal lobe, this one, we're just more thinking about our processing speed, okay? Spatial awareness, right? You might start to notice this person's bumping into things more, or they're not able to feel things in the same way they once were, right? They might touch a hot cup and be holding it and burn their hand or, what have you. And then occipital, this is vision. Depending on what side, it can really affect, okay, one eye more than the other. Also, our depth perception, our ability to sort of recognize distance. So you may not be able to drive anymore as a result, right? Or you may be seeing different colors. So we don't want that happening when we're looking at traffic lights, right? And then lastly, the temporal lobe, which affects our auditory processing, our hearing, our ability to even understand, right? And so we might not recognize people's faces. We might not know, okay, like this person's smiling, but I don't know if they're smiling. I can't really recognize or see what's going on, right? And so, really understanding where that tumor is can help us to be a little more aligned with what to expect. Okay. And now, similarly, we have the left and right hemisphere. I feel like this is what most people know, right? Left brain being more focused on logical thinking, analysis, mathematics, all of these sort of fun things we learn in school. And then the right hemisphere being aligned with more of the creative side of things, right? And that's being able to have a nice daydreaming session, being musical, having dreams, all of these different things that can really help with even multitasking as well, right? And so, in thinking about your personality, who you've been your entire life, and if you were to get a tumor in the zone that's maybe less dominant, you might find that the arts are all of a sudden more available to you, or your creative side, right? Or you may be better at math than you thought, or that may become a priority for you, okay? So we're going to just keep going past here so that we can get to the more practical stuff, okay? So, what can we do? Now, as we think about that, the first thing I want us to sort of think about is how do we recognize the impacts of cognitive fatigue? And by cognitive fatigue, that just sort of meaning the sort of exhaustion we experience from overstimulation, right? And so, in looking at this chart, on the y-axis, we can see performance. So that's what we're doing, or our behavior. And then on the x-axis, we see the stress level, okay? And so as the stress level increases, you can see it goes all the way to high stress. And as the performance level increases, there's that zone right in the middle, that sort of sweet spot where we're feeling like we're in flow, right? You're creative, you're engaged, you're really motivated, you're feeling energized, right? And then if we are under stressed, right, we're probably not going to work too hard, right? It's like when you've been assigned a really menial task, or you're maybe playing with a baby and, all you're doing is jiggling some keys, right? We're not too stressed, but we might get bored after a while. Now, once we get into this high stress zone of overstimulation, this is where we start to experience more of that cognitive fatigue, okay? And this is really important thinking about how the tumor affects us. Now, we may feel overwhelmed, burnt out. This is where maybe some more of those volatile emotions start to arise as we lash out, because we really just don't have the patience anymore. I like to refer to it more as the window of tolerance. And depending on how open or closed that is, more open, we have a lot more patience. We're able to sort of tolerate things. And when it's closed and narrow, or it's like your anger bucket, when it's full, I'm snapping at any given moment, right? Now, when the brain tumor affects us in that way, because now the brain's having to work so much harder to do its usual tasks, right? And whether this is due to the treatment you're receiving or the tumor itself and what part of the brain it's located in, we're entering that overstress zone a lot more rapidly. So we need to have that much more patience with the patient and try to understand, okay, how do we keep that cognitive fatigue at a minimum? Okay. And so some of the ways we can do this more broadly, and just split it up to make it a little easier, and I'll be sending out this PowerPoint at the end and then some other notes, so you guys have a little something, a little goodie bag to take home with you. In thinking about the more general means of dealing with cognitive fatigue, we want to sort of break things down, create a bit of slowness within our routine. Now, I've put this section as general so that we can be a bit more broad around our calendar. We're not going to have any sort of short-term effects from these. So we want to take frequent breaks. We want to allow the brain to recharge. So this sort of meaning, okay, there are neurotransmitters that go through and allow us to feel either accomplished or feel good about ourselves and boost our self-esteem, all these sort of things. But if they're not moving as quickly or restoring themselves and replenishing themselves, we're kind of at a deficit, right? And so that usual dopamine surge that you get that makes you maybe feel good about like doing something is taking a little bit longer to recharge. So we need to sort of slow down. That's why we want to have a bit more of a gradual pace with ourselves, or giving the patient a little bit more time to sort of get back to normal, right? Back to homeostasis, okay? We want to also avoid triggers. I mean, I don't know about you, but I always want to avoid the triggers in my life. But they're going to have a far bigger impact, in this case. And then we want to prioritize rest and sleep. I'm sure your doctor has told you this a billion times, with or without cancer, right? We know this is important for memory consolidation. We know this is important for even being able to sort of function. It's not just about not feeling sleepy, right? It's about all the sort of invisible processes that go on when we are asleep. We also want to have structure, which you may know. Now, if you're someone who's been loose and able to sort of live your life fully by being spontaneous, this may not work so well because with spontaneity comes uncertainty, and with uncertainty comes more cognitive fatigue, right? Because now I'm thinking, making decisions that, are going to drain me that much more rapidly. Okay. And then next, we want smaller groups. We want to keep activities short. So we don't want to be sitting in like a 5 hour movie. We're not watching Lawrence of Arabia or anything like that. And we want to set boundaries. Now, this one is a big one, and I think it's really challenging, especially if you have a lot of family who's coming in and, oh, they all want to help. But if that's going to lead to overstimulation for the patient, is it really helping? So, how do we communicate that in a way? How do we maybe even have a document that we share? You might want to use even Caring Bridge or one of these websites or send out mass texts, something to just let folks know things are different now, right? And even if the patient looks the same or maybe they seem the same in most moments, depending on the level of progression, we want to set those boundaries as early as possible, so that no one feels offended, no one feels too upset, and that we're all sort of coming together. Okay. And now thinking about the short-term ways we can sort of decrease the stimulation. So things you can do, and this sort of falls into that sort of mindful zone, right? We can close our eyes for a moment, knowing that all the stimulation and neural activity going on from our vision can be quieted for a moment. We might want to use noise canceling headphones, preferably over the head, right? Knowing that if we're using little earbuds, those might get lost as memory wanes. So we want to have something that's easy to find. We just want to make things a little bit easier. Okay. And we want to maybe try and find a quiet place. I think it's really amazing and important to try and do so in advance so that in emergency, or let's say you're out and about and lo and behold, we're having a conniption. We want to know, okay, we're going over to the fountain over here, or oh, we're going over to the tree that we designated, or in the house, oh, we have this room that we, call a closet, but that's actually the quiet space, right? We just want to find a place that's going to just lower the noise in the head, okay? And then we can regulate our nervous systems. And by this, I mean just sort of quieting that electric action, right? And so we can do deep breathing, diaphragmatic breathing, whatever you want to call it. We can stretch, you can do some yoga, some qigong, some tai chi. You can just do something to sort of get into your body and away from your thoughts, right? And you can have a physical anchor. Whether that is something you hold, you can have it in your pocket, or it's like a little stress ball, or you like to hold your keys, like whatever that may be. Just want to have something that can sort of offload that stress, okay? And so, a couple things to think about as the patient, especially in cases where we're losing focus and executive function. One of the things we want to do is stop and name it. And we can even say to ourselves, okay, I'm distracted, right? There might be that moment where you're in the middle of something and you're moving left, you're moving right, you're having maybe your first feelings of ADHD in your life. And maybe it's new to you, or maybe you've always been that way, but it's felt a bit more manageable because you had a different sort of brain capacity, right? And so the first thing we want to do is just stop and say, okay, I'm a bit distracted, I'm overwhelmed, I'm a bit flustered, okay, I know I need to kind of like slow down for a second. So we're going to do some of those activities I mentioned earlier, right? I might just sort of like breathe. I have my headphones. I'm going to listen to some like fun frequencies and different ranges that's going to calm my brain, or just some jazz or, classical music, something to calm me down. And I'm going to disengage, this part being really important, right? If I'm in the middle of a bunch of chores and I feel overwhelmed, I'm just going to go sit down for a second. I don't need to continue the task just yet. Even just a minute can do wonders, right? And so I'm just going to sit down, close my eyes, breathe for a minute. Maybe I have an app or something that I like to use, or maybe there's a recording that I have that's particularly calming for me, and it's like a loved one reading my favorite poem or something, right? Because I think the more personalized it is, the better it's going to be for you, right? And then once you're ready, you can go on back to your task, okay? But also, it's so important to ask for help when you need it, right? We cannot be afraid of this, and like having that open channel of communication, it's going to decrease that feeling of isolation, which is so important, right? And as we all know, that's going to lead to that much more of a nervous response. And so we want to just sort of accept and be open to help as we can get it. And the last thing I like to think about, which you may already be doing with or without cancer, is talking yourself through a task, right? You go back in the house and you're like, okay, I came in the house to do something, or you enter that room and you kind of forgot what it was. you can just talk yourself through it as you're doing it. Okay, I'm getting my keys. I'm getting my keys. I'm getting my keys. Say it out loud to yourself. Say it in your mind. Just stay focused as well as you can. And just don't worry about embarrassment so much. You know what you're going through. That's why we're naming it, right? That's why we're able to sort of say, and then we can take a little bit more ownership and know that it's not entirely tied into my identity or anything like that. It's that we have a brain tumor and we're just trying to use some techniques to exist. Okay. And so, in thinking about memory, we always want to sort of use the tools we can in order to sort of best allow memories to sink in, right? And you may have learned some of this back in like grade school, maybe even in college, but one of the things we know, even when we're studying, is that teaching and experience are definitely the best ways for us to build memories, right? And also knowing that when I read something or hear something, it's not as likely to stick, right? That's why you'll end up sitting and reading a page 500 times while you're at the beach and the pina colada is getting a little lower, right? And so as you're thinking about what are the best ways for me to learn, what are the best ways for me to, if I have a kid, I want to teach them something that's meaningful, or I'm learning it with them as we're using our hands or what have you. We want to be really intentional about that so we can build the strongest memories we're capable of building. Okay. And thinking about the memory, we don't need to go through this, but this is just sort of a short diagram on how memory works, right? So we have broader memory. We have the sort of sensory register, which is, me picking up my mug and feeling, oh, I can feel it on my hands, right? Or, oh, I can smell that thing, right? And I smelled it earlier. Now we have short-term memory and then we have long-term memory, of course. And as we think about long-term memory, which is broken up into explicit and implicit, implicit being unconscious, much like, okay, I ride a bike. I don't really have to think about how to ride the bike. My body just kind of does it, right? Or when I'm cooking or cutting something up, maybe it's a bit between both, right? Because I'm using more technique, but I still know how to grip the knife while I'm cutting, right? And then there's the more declarative memory, which is, of course, episodic and semantic, right? Semantic being, okay, I know what the capital of Virginia is, and episodic being, remember that time we went back to this place, right? And one of the things we know is that we have trouble encoding memories sometimes, depending on where the tumor is. But with memory loss, episodic memory may not be as available as we have trouble in sort of amnesia, trying to write new memories, right? So you may tell the loved one, the patient, "Hey, remember I told you this thing?" And they're like, "I have no idea what you're talking about," and that has everything to do with their episodic memory not functioning as it once did, right? And so just even being able to understand how does memory work can be really helpful. Okay. And so, a couple last things here. We really want to take our time, as I mentioned before, right? Just sort of slowing things down, really being patient with the patient or ourselves. Okay. Next, we want to designate places for important items. So we want to start to be as organized as possible. And if that means color coding, if that means putting little post-it notes or stickers on things so we can remember, oh yeah, this is where the dishes are. Oh yeah, this is where we put our keys every time, right? We have to make sure. If it's not there, then we're a little bit lost. If I need an air tag, I'm going to get the air tag, right? And then we want to start documenting everything. And I know this can be really tedious. But it is incredibly helpful, and journaling just generally helps us with encoding those memories as well. So if you're able to journal at the end of the night, okay, these are all the things I did today. This is what I remember today. That's going to help to build those networks in your brain. You're attaching it to those different things, the senses, the feelings. As you revisit, you're able to recall that much better, which we know is like a basic studying tip, right? And then we can have mnemonics. So those are just little ways of remembering things. And I've got one for you guys later, but so it might be like a story. You might have heard of memory castles or palaces, really just sort of fun ways to try and commit things to memory, or like a name or something. And then memory apps. Fortunately, it's 2026. There are many apps out there that can help us with memory. Whether that's just like scheduling, whether that's names, whether that's like whatever, they're out there on the marketplace. And once again, like, please don't hesitate to use AI for these sort of things. You need to assist yourself so that you can have as much time doing what you enjoy as possible, right? And so let's keep going here. So we're going to move through this one quickly. So I think it's pretty intuitive, but some of the things that our patient may be feeling are these sort of stronger feelings of pride, shame, or guilt, right? Pride is something we always sort of need to recognize and dismantle. It's something you can do with your therapist, with loved ones, just sort of recognizing. And it's hard to say, like, I'm not who I was, right? If you were someone who was really proud of, the intellect you curated over years and years and years, and you have this fantastic library, and now it's challenging for you to even read more than a page, that doesn't feel great, right? And so, what do we do with those feelings? Do we take them out on someone? Do we try to read the book even more aggressively, or do we try and adapt? Do we say, okay, I accept this is what's going on for me. I need to talk to someone about this. I need to maybe cry. I need to vent. I maybe need a rage room or something, which honestly doesn't work. So please don't do rage rooms and you might hurt yourself. But how are we sort of opening up about this? Do we have community? Are we able to be really transparent? Because I think like that can be the most important thing during this process, right? Because often that shame is what kind of walls us in. As we say, people expect this of me, right? I expect this of myself. I sort of see myself this way, right? How do we start to see a different identity within ourselves? And not necessarily a worse one or a weaker one, just a different one. We don't want to necessarily ascribe judgment just yet, right? And then once again, thinking about grief, and it's really so important to sort of control what we can in any given moment, okay? And then these are just a couple other things that we always want to think about for the patient that may be coming up. There's sort of shifts in, okay, maybe I was the breadwinner, now finances look different. On top of that, we have all of these fees we're paying for treatment and so on. I'm not able to go out as much as I used to. I can't drive anymore. I'm not able to connect with my child maybe in the same way. How do I start to address these things with what we call the beginner's mind, right? This is where mindfulness can sort of come in, right? I'm not so much looking at the past and saying, okay, this is all I've done, this is all I was. I'm saying, okay, right now, in this moment, and let's say I'm talking to my kid, what is it that's coming up for me? What are they looking for from me? What can I give them? As though I am a beginner, as though I'm sort of just teaching myself and learning along with them, right? And I feel like that ties in so well with self-compassion. What do we say to ourselves? And are they words that we're using kind words or these words of expectation and self-hatred, right? And I think a lot of that starts up, especially depending on where that tumor is, right? Because we don't necessarily even have the kindness. And if we're experiencing that cognitive fatigue, we might not be in a space to say, oh, I can create some warmth for myself. Thus, we need to breathe. Thus, we need to slow down, right? And have some sympathy for ourselves. And then lastly, we really want to just sort of recognize, okay, what are my strengths in any given moment? They may be different, but that doesn't mean I don't have any, right? And if I'm not able to help in the same way I could, does that mean I can still be helpful in some ways? And how can we acknowledge that need internally for any of us to help? But we also always have to recognize, as with any cancer, there's something going on inside of us, and there's a war that requires us to rest as much as humanly possible, right? So we always have to sort of recognize our limits. And I know that's different for us, right? Like, depending on where you are on the socioeconomic scale, depending on what phase of life you may be in, it can be incredibly challenging, right? Especially if we factor in mortality. But that's all the more reason why we need to stay present with what do we have right now, right? I can think about all the things I had, I can think about all the things I want, what's going on right now and how can I use what I have in order to make what's best for me, my family, and so on. Okay. And trust also being just so significant, right? Who is your trusted person and can you trust them above all else, right? And if you don't have that point person, I hope you're able to find one. Sorry, I don't want to skip ahead too far. So let's get into the caregiver tips, okay? So we've got quite a few here. I'm going to also give you guys a document so that you have them for later. So be sure to tune in for that. Now I'm going to kind of breeze through a couple of these because I think some are more important than others. But we're going to try and get through as many as we can with what time we have. Okay. So in thinking about aggression and irritability, this ABC functional analysis is derived from cognitive behavioral therapy, okay? And so all this means is in all of our reasoning, functioning, and so on, we have the antecedent, which is really what precipitates the belief or the feeling or what have you. So let's say someone comes and steps on my toe, right? That is the A antecedent, right? B, the belief, okay, what happens in my head next? That might be everyone hates me and they don't like that I have new shoes, right? Which leads to the consequence of I'm going to make them feel bad, and so I'm going to step on their shoes instead, right? Now, in thinking about our patient, our loved one, and thinking about how antecedents are perceived differently, right? If the brain is different, then of course it's not receiving these prompts in the same way. And so that's going to lead to different consequence, right? And so what we always want to do, and what's so important here, is thinking about what actually is causing them to maybe get upset, right? And does it have more to do with, oh, it's an environmental thing, like, oh, we usually don't do this, and that's making them feel a little stressed or scared? Or is it something about maybe they were doing something, right? Oh, they used to be really good at reading, and now they're not able to read, and so they're that much more frustrated, and that's sort of just sitting and stewing in them, right? And so being able to sort of figure out, okay, like what is the cause? What is the antecedent there? Because then it becomes quite linear to understand, okay, this is what's going on with my partner, okay? And so coming back down to these other ones, we want to always think about, okay, de-escalation or the low arousal approach. So thinking about, okay, I don't want to make too much eye contact if they're upset. I want to sort of keep 2 feet away just in case like they might have their fight or flight response triggered. We know that medically induced aggression is a thing, right? If they're taking steroids, if they're taking seizure meds, this can alter their brain chemistry, leading to a lot higher arousal, right? And then cognitive redirection, just sort of thinking about how do I stop the process of correcting, okay? You didn't tell me that. That never happened. Whatever. Instead of me saying and going along with, I did tell you that. I was there and you listened to me and I swear I heard it. We're just gonna pivot, right? We're just gonna move to something else because all we're doing is getting ourselves upset, which is getting them more upset. So instead, we want to recognize what's underneath that feeling because now they're getting frustrated and confused, right? And so what we want to say is, hey, you seem really upset. Or if that's too much, we can say, hey, let's just take a moment and go outside. I just put up a bird feeder. Can we go check that out for a second? Or, oh, hey, let's go have some cold water for a moment, right? Now, you may have tried this before, but what we're doing is sort of thinking about it at the neurological level, right? We want to create a sort of hard reset for the brain's neural loop, right? Because they're caught in some sort of loop that's leading to frustration and thus aggression and irritability, right? We just want to pull them out, different hormones, different mood, different zone, okay? And then having a crisis plan is fantastic. Obviously, if worst case scenarios, we want to have, okay, like this is what we do. This is something you can discuss with your physician. And then being able to remove choices and options. And so I put my mnemonic there. I guess it's just an acronym. KISS, keep it simple, stupid, right? We don't want to give them a plethora. We want to give them two options at most. It's a little 48 laws of power, but give them one option that's great, the one you want them to do, and then give them something else that they really don't want to do or never would, right? And that way you're going to have a little bit more control over the situation, okay? And next, thinking a bit more about memory. We can use the habilitation approach, right? Which is very different from the rehabilitation approach. So instead of trying to make them their old self, which is what rehab is, right? If you've done physical rehab or anything, we're trying to meet them exactly where they are. We're focusing on success. We're focusing on connection. If they're not able to cook a full meal, have them just shuck the corn, right? If they're not able to shuck the corn, have them set the table. If they're not able to do that, have them sit down and see if the chair's working, right? So we just want to sort of lean into, okay, what's going on here? We want to lean into emotional connection as opposed to connecting over tasks, right? Because what we know is memory is not where it was, okay? Next, we want to think about validation, right? Sort of going back to what we said earlier. Hey, I see where you are. I'm understanding what's going on, or at least I'm trying to, but really all we're trying to do is step into their reality, right? Seeing, okay, what is it like for them in this moment? Being able to sort of bring ourselves down, we might have to take a breath too and say, okay, I'm actually upset, right? Now I'm feeling a little bit, dismayed. Slow down, take a seat, and say, oh, they're upset, right? Always recognizing what's underneath the behavior you're receiving, right? Because often it's just something a lot more carnal, right? And they're just upset with all that's going on or the confusion or anything that's happening in the brain there, okay? Environmental modification, this is sort of similar to just making the house a little bit easier. You might be putting up your little signs and so on. And then routine and anchoring. Anchoring is really just the process of making sure there's some consistency throughout the day, right? This way we're not dealing with the confusion quite as much. They kind of have an idea of where things are, or at least you do, so that you're not wondering, oh my God, I have to remember for two people now. I can kind of have a bit more routine. Knowing that routine, much like with little kids, right? Routine is going to be your best friend, okay? And then lastly, this a nosogogia. Basically, when folks aren't able to recognize their own inability to have memory problems. So basically, like they don't know that they're forgetting things, right? All they know is their present reality. So even if you tell them, all that's going to do is frustrate them, right? Now, this is a little bit more progressed, but we just want to be aware of when that happens, okay? And knowing that our partner is probably trying their best, hopefully. And so shadowing, now this is the phenomenon where a partner is kind of following us around, we're not able to really breathe or get a moment for ourselves, and we want to maybe, run errands or what have you, right? And so some of the things we can say or do, and really it's about the framing. I can say, okay, I'm running an errand. I have to go out and do this thing, right? And if I'm saying this, I might want to say, I'm doing a thing for us, right? That way it doesn't feel selfish. That way it doesn't feel like you're getting rid of them. That way they're still involved, okay? And then therapeutic fiblets. So these are just like tiny lies, right? You might actually be going out to watch a movie, but you're leaving them with a caregiver, hopefully, and you might say, hey, I got to go to a work meeting. You go away, they kind of hopefully forget or they don't forget. And then you come back and say, okay, the meeting went well. Maybe they don't even remember that you said that to them, but sometimes we're going to have to be a little creative in what we say, right? As long as we're not intentionally harming them, hopefully this can work out, okay? And then having a handoff transition with our caregiver, this can be really helpful instead of doing a long goodbye or anything like that. We just want to sort of say, hey, let's start this activity, right? Okay, we're working on a photo scrapbook or something like that. And as we're doing so, I'm going to say, oh, I'm going to go over here for a little bit. And the caregiver is now helping with the scrapbook too. And you're able to kind of go ahead and go, right? That way, there's even sort of a bridge that's happening there. Now, the bridge object relation here is more about I want to have something, sort of an anchor point, excuse me, so that they know I'm coming back, right? Hey, can you hold this for me, right? Or hey, I need to get this done. Can you just get this started for me? Really just giving them something to know, oh, they're coming back, right? Knowing they're not leaving, sitting there empty-handed, like, where did you go? Okay. Or you can leave a message or a note for them so they can refer to it and it says, hey, just went out to get some stuff. I'll be back. I love you, right? Just making sure they feel good, right? Once again, always sort of addressing their emotions, not necessarily logic quite as much, okay? And then lastly, these are a couple more tips, but I want to make sure we have some room for questions here. And so, but we always want to sort of think about the fact we don't need to defend ourselves in our actions in some cases. I mean, you might have to in many cases, actually. But in thinking about, okay, I don't necessarily need to say to you, hey, I didn't do this thing, or hey, I've been here every day. Like, how can you say these cruel things to me? I've been working so hard for you. That's not helpful, right? Because we're addressing their amygdala now, which is like sort of the fear, anxiety response zone in our brain, right? Instead, what we want to try and say is, it sounds like you're really scared when they're saying something like, you're always leaving me. It sounds like you're really scared. Hey, I'm here. I'm right here with you. Give me a hug. Now they're starting to calm down. Now we can use some of those other tips. Okay. And then we want to make sure there's a little bit less preparation time. So this is just sort of meaning I'm not going to be telling them every single thing that I'm doing on my way out, right? Oh, we have to go do this and this and this, and like, oh, I'm so sorry, and goodbye, goodbye, goodbye. We want to make it a sort of quick exit, almost a last minute thing in each case, because the more story, the more opportunity for them to start to get agitated, right? And scared. So we want it to be quick. That doesn't lead to so much fear. That doesn't lead to the same sort of response. We want to keep things as brief as possible, okay? And then when we're leaving, once again, I'm getting dinner for us. I'm doing these things for us, right? It's not about isolation. It's not about selfishness. Or I can say, I'll be right in the other room. I might be gone for a little bit, depending on the stage of their mental decline, okay? And then lastly, we want to really sort of center their fear of abandonment in these moments. If that's the case for your partner, just being sure that that's being acknowledged as you engage with them before leaving. Okay. And so, just sort of thinking about this, when they say to you, hey, you want to abandon me, what their brain means is, I don't know who I am or if I'm safe when you aren't in my sight, right? And we know that this is also a sort of pride thing, right? It's a backhanded compliment, definitely, in saying how much they trust and need you, but it's not always going to come out that way, right? And so you being able to, as a caregiver, translate these words in a way that's meaningful to you is also going to decrease your frustration, okay? And we always have to sort of take care of ourselves. Um, so we've got a couple other slides here, but I think the final bits that I want us to sort of conclude with are acceptance not being approval, right? And that goes for both the patient and the caregiver, knowing that this is happening, yes, but that doesn't mean I have to love it, right? And so in doing so, we're able to maybe acknowledge the sort of care that we need, the slowness, the softness, the community, all of these sort of aspects, right? We want to avoid self-criticism. We also want to sort of recognize there's always what our expectation is versus what reality is. And the wider that is, the less likely it is for us to experience joy or to even enjoy the moments that do present themselves and offer peace, right? Um, and then here at the center, we have a number of fun things that you can do to take care of yourself. We have counseling, we have support groups, we have fitness so you can make sure you're in shape. And then, of course, we have a child life specialist who can speak to your kids and you if you're having trouble having some of these conversations, right? And then don't ever hesitate to look at our calendar to see some of the lovely events that we've been putting on. As they're always shifting, much like this one, every month. And yeah, that's our presentation. Any questions?
Thank you, Dom. I don't see any questions that came up in the chat, so I'm going to go ahead and stop the recording.
All right.